Hi everyone, this is Dr. Brian Murphy with Pinnacle Physical Therapy. Many of you know me, and if you don't, I wanted to introduce myself and give you some insights into something that I feel like is very important for you to know and understand. When you're in pain, especially when it's of musculoskeletal origin, meaning I have an ache and pain in my elbow, or my back's been hurting, or maybe my knee's bothering me. Physical therapy is a great option for you to get evaluated and to get on the road to recovery. I want to share a patient story with you. I saw this gentleman yesterday. He had gone to his primary care physician. He had been complaining of some pain that was kind of going down his leg on the outside of the front of his leg. And in his knee would give way. He went and he told this to his primary care doctor, and his primary care doctor gave him an injection into his hip, thinking that the discomfort was coming from the hip joint. He prescribed medication to the patient, and then he actually sent him to a pain management center. Now, a lot of these pain management centers, they specialize in injections and prescribing medications for the long-term solution to your pain. What was unfortunate is that this patient's pain actually had nothing to do with his hip. The pain was actually coming from his knee. And I was able to find that with an evaluation, and instead of this patient having to take those medications and go to see a pain management specialist, I'm going to be able to treat him in my office here, and he's only going to need 4 to 6 visits, and his pain is going to be completely gone. He's not going to have to worry about that knee collapsing underneath him anymore. He's going to be able to go back up and down stairs. He works as a stonemason, so he's always up and down, and it was really affecting his ability to do his work. He'd wake up in the morning in excruciating pain, and it would get worse as the day went on. So what I'm trying to highlight here, I'm not trying to bash your primary care doctors. If you're sick with the flu, if you have some other body system issues, if you're, of course, diabetic, or if you have concerns with blood pressure, cholesterol, things like that, they are highly skilled physicians that can help you with those things. A lot of times, unfortunately, in medical school, when it comes to musculoskeletal care, they get a semester of training, and oftentimes, unfortunately, it's just, hey, I'm going to prescribe you medications, which only treats your symptoms. It doesn't get to the root cause of the problem. So at best, you're going to be taking something into your body that's going to have potentially a negative effect on you, and it's just going to put a Band-Aid on your pain. You need to find a practitioner who can specifically find the root cause of the pain, because if you don't find where it's coming from, you can take medications all day. What ends up happening if you ignore it, which a lot of people do, then you start to compensate. That's when he was limping. All of a sudden, he was also complaining. That's why it was radiating up his leg. That muscle actually started in his hip and went all the way down the outside of his leg. He was already starting to limp, so he was also describing low back pain. That's what happens. Your body compensates, and then all of a sudden a knee problem or a foot and ankle problem becomes a back problem, which then becomes a neck problem, or vice versa. I have a shoulder issue. Now all of a sudden I'm having headaches because the muscles are guarded and protecting that area because you didn't deal with it right the first time. Nobody wants to take more medications. We know that Arkansas specifically is in an opioid epidemic. Long-term relief of pain oftentimes can be helped by physical therapy. You need to have a great physical therapist on your team to keep you moving, keep you healthy, and hopefully to try to guide you through the system, because this gentleman, God forbid, he would have gone to that pain management center. Of course they would have injected him, because that's what they do. They would have given him injections potentially into his back, another injection into his hip. He would have been on potentially long-term narcotic medications. And I'm going to get this guy better in 4 visits. I think it blows my mind that he would have inadvertently, from a physician that he trusted, gone down that route. Fortunately, the pain management center said, hey, we need, for insurance purposes, we need to actually have you see a physical therapist before we can see you. So they can't order an MRI, they can't give you injections and medications, because you know what's happening? The insurance companies are actually seeing that, hey, we can get patients better if we send them to PT. And that saves them a lot of money. But at the end of the day, it helps you get better. It saves you time and money. And it really gets to the root cause of the problem so that you can get back to doing the things that you enjoy. So please remember, I am here to always be a resource to you. At Pinnacle Physical Therapy, I want to help you stay active and get you out of pain.